Hi, this is Alex from Chicago. My question is, how many employees need to be on the health plan for the captive solution to make sense? And do you guys have minimum requirements in order to join?
Yeah, this is a good one. We get this one a lot. Dave, do you want to take this one?
Yeah, so typically we tell the market 50 enrolled employees or at least $500,000 of fully insured premium equivalent. Now, that's a soft floor. We are able to sometimes go a little bit lower than that. It just sort of depends on the market.
Hi, and welcome to the Captivating Health Insights podcast. This is our final episode of our mini-series on captive education. And this session I'm super excited about. It's called Ask Us Anything. We solicited questions from you, our listeners, and we're excited to answer them for you today. So with that, we have our podcast guests back. Thanks for coming back, Dave Gillis, Kevin Hallen, and Joe Parrilli. We're going to jump into your questions. But first, because we've started this in season 2, love it or hate it, I have a question that I've been asking all of my guests just to help get to know our guests a little bit more. And so with that, I would love to ask you 3, if we really knew you, what would we know? Joe, if you would kick us off, if we really knew you, Joe, what would we know about you?
You would know that I am deathly afraid of needles and blood.
Okay, all right.
Well, I think you would know that I am a very mediocre basketball coach for my first grader and fourth grader.
I appreciate the humility there.
Yes.
So. Awesome. And last but not least, Dave, if we knew you, what would we know?
Kind of a boring answer, but first thing that comes to mind, a bit of a golf fanatic. Like if I'm not peddling captive insurance or spending time with my family, like I'm probably on a golf course.
Golf. Well, you made the right choice with the insurance industry because those seem to go hand in hand most of the time.
If I had a nickel for every one of those jokes.
Well, thank you for answering the question. Love asking that question. So appreciate that. And with that, we're going to get into our Ask Us Anything session. So this is our first question. Here we go.
Hi, this is Ashley calling from Cleveland. And my question is, how customizable is a captive arrangement?
How customizable is a captive arrangement? Good question.
So the captive is completely customizable, and you have to remember the medical stop loss plan is what the captive is rooted in. So everything from what the employees see, deductibles, copays, all the way up through what TPAs, what pharmacy groups are going to use is completely up to the group and customizable by the group and their consultant. The only thing really dictated by the captive is what stop loss carrier they're going to use, because that's the reinsurance mechanism that makes the captive go. But everything else from a deductible perspective is completely up to each individual group in the program.
Gotcha. Up to the employer to decide.
And I'll just add that it's also a program that can appeal to a wide array of companies, whether from a enrollment size, it can fit smaller companies down to 40, 50 enrolled up to several thousand enrolled. It also is a program that allows you to choose the amount of risk that you want to take on your self-funded plan, so you can choose your own specific deductible. So there's also flexibility from those aspects.
Awesome. Anything else you'd add there, Dave?
Just that's also another reason why we support so many programs is, one employer might go into this program, but there's another employer that won't fit here. They're better suited over here. So that also, I think, speaks to the customization as to why there's so many different programs.
Mm-hmm. Awesome. Thanks, Mike, for the question. Ready for our next question now.
This is Derek from St. Louis. I was curious, what reporting cadence should employers expect once inside one of the group captives?
Reporting cadence. Let's take that one.
Yeah, I'll take a shot at that one. So obviously, they're going to continue to get the reporting that they're used to if they're self-funded already from their TPA today. In addition, the captive produces monthly claim reports, so they can see how their claims are doing versus their loss funding, their ceded premium. And then these programs are member-owned. They're very transparent, and so they're also producing financial statements, full sets of financial statements that members and benefits consultants get access to, twice per year.
Awesome. Great question. Thank you. Next question.
Hi, I'm Michaela from Atlanta. My question is, what's one operational surprise that employers experience after joining?
It's a good question. Operational surprise, I guess, could be positive or negative. Do you want to take that one, Dave?
Sure. So I think a positive, and we talk about this when we're educating employers about what it means to join a captive, but the renewal process is a lot more transparent and streamlined than what they might be used to on the traditional side, whether it's fully insured, level funded, or even traditional self-funded. Because when the underwriters come back with what that potential increase is going to be, they're going to tell you exactly what's driving that sort of increase. So it's just much more of a collaborative experience than what they're used to.
I would say the other thing is people tend to think captives are more complicated or involve a lot of change within their organization. Operationally, none of that has to happen. Your employees don't change their ID cards. It is very seamless relative to what the everyday end users of the health plan end up seeing day in and day out, because they're still going to whatever network the company chooses. Their ID cards say nothing about the captive. It's business as usual from that standpoint related to the health plan.
Gotcha. So really the employee experience doesn't change. The employee wouldn't know if they're in a captive or not. Or
Oftentimes they wouldn't know that they're in a captive. Now, some of the programs that members put in place, maybe pharmacy programs that are designed to help them impact cost, also have knock-on benefits for employees where they can save money as well. So there are certainly benefits that they see. They often probably aren't realizing that is coming because they're in a captive.
Right. It's the same, but on the back end, we know that there's things going on that are helping manage the plan. Okay. Thanks so much for that question. Let's hear the next one.
Hi, this is Emily from Chicago. My question is, what would surprise most CFOs about captives? Thank you.
Oh, that's a good one. What do you guys hear from CFOs?
I think the transparency would probably surprise them the most. The fact that they can see how the captive is operating and frankly, the stop loss insurance the same way they can see for their own company. They get the financial statements, as Kevin mentioned. Not only is that how the actual captive is running, it's every de-identified member in that underwriting year and how they're performing, how much risk they're causing or absorbing, investment income. I mean, it breaks down everything. So it is really taking what a CFO would be used to relative to an individual entity and now doing it for the insurance.
I would also add that for a lot of CFOs, they think about it as a financial product. But what they would find if they were to talk to members that have been in captive programs for a while, even ones that have saved a lot of money being in the program, when you ask them what their favorite part of the program has been, it really is that member-to-member engagement, the discussions they have with other members about strategies they're using, about things they're doing to get employees to engage and be better consumers of their health care. And really that engagement is very well received by the membership.
Mm-hmm. And those strategies aren't just health strategies all the time. A lot of these members are talking about business ideas that go beyond health insurance. A lot of our members end up doing business together for selling boxes, whatever the case might be. Mm-hmm. So I think, the surprise is it's much more from a community perspective than just let's talk about healthcare.
Yeah, not just a healthcare decision or even conversation, but it goes beyond that, just business to business and general networking. Yeah, great point. Anything you'd add, Dave?
Just going back to Joe's first point a little bit, in the traditional market, CFOs don't get to see much information, right? They want to see the numbers. They want to know what the budgets are. And so when you give them all this more information, the CFOs tend to get more involved once you're in the captive versus if you're in the traditional market, they're not as involved because they don't feel like they can add any value. Mm-hmm. They can start to add a lot more value once you're in the captive.
Got it. It's not just an HR benefits thing. It's, hey, this is a whole, it's a organizational decision and conversation. Mm-hmm. Yeah. Awesome. Thanks for the question, Monica. Let's go to our next one.
Hi, this is Alex from Chicago. My question is, how many employees need to be on the health plan for the captive solution to make sense? And do you guys have minimum requirements in order to join?
Yeah, this is a good one. We get this one a lot. Dave, do you want to take this one?
Yeah, so typically we tell the market 50 enrolled employees or at least $500,000 of fully insured premium equivalent. Now, that's a soft floor. We are able to sometimes go a little bit lower than that. It just sort of depends on the market. Some states are a little bit easier from a stop loss regulation perspective. But really, I would say 40 enrolled is really the absolute minimum. And, soft cap on the upside as well.
And just for people that don't know, what is the fully insured premium equivalent?
So whatever the annual fully insured might be for medical. Sometimes we get questions about, does dental included or vision or life? And it's just medical.
Okay, so what you're paying as a fully insured client, what's that kind of bottom line medical, and how does that equate to the same when you're self-insured?
Yep.
Okay, awesome. Thanks for the question. Next one.
Hi, this is Rachel from Chicago, and I'm wondering what kind of claims history do employers need to share up front?
Claims history.
Yeah, I'll take a swing at that one. So every group is going to be a little bit different, whether they're self-funded or fully insured currently. Sometimes states play a big role into that. Size plays a big role into that. We would love, our fronting carriers would love, and the folks that do the underwriting, all of the detailed claims information. So large claims, paid claims, case management notes, any trigger diagnosis. And that's not so much a captive thing, that's stop loss underwriting, because that's the policies they're underwriting. But we understand we're not always going to get that information. So in situations where groups are fully insured and they don't get claims history,
Right.
We'll look at 3 years of fully insured renewals and make determinations based on what those increases have been. So there isn't a one size fits all for every group in the marketplace. A lot of times we're going to take the absolute most we can get and then make determinations from there and let truly the underwriters make the determination if that's enough for them to properly price whatever that risk could be.
Gotcha. So the underwriter has to be comfortable with how much data is available for them to make that decision.
The underwriter is the first stop.
Mm-hmm.
The role a captive consultant is going to play is to protect the captive as well. So if our team doesn't feel like there's enough there or there's a bunch of unknowns, we have to protect the people that own the captive as well. So it's a good collaboration between the entity doing the underwriting, the captive consultant, the brokers, the groups. Everybody has to be sure that it's a good fit based on how the captive is structured. Otherwise, it's just not the right time for that group.
Which is important because you want to accept good risk into the captive. If you're going to let someone in, the other members want to know that we're doing our due diligence in that, right?
And it goes back to what Kevin and Dave talked about too. Being that the members get those full financial statements, they can see how everybody performs. So they could ask the questions of the captive consultant, how did so-and-so get in if they've caused risk the last 3 years? And that's important to being a member and an owner of the captive. So we'd rather be overprotective when it comes to companies getting in versus trying to outrun losses, which for a captive is not going to work.
Mm-hmm. Yep. Yeah, great question. Anything you'd add to that?
Just to add, having captives with multiple fronting carriers, different fronting carriers have different approaches and different strategies that they use to underwrite accounts. So I've found that it helps us to be able to kind of meet different companies where they are given their individual situation and help us be able to find a good home for more companies that we're seeing.
Yep.
Awesome. Anything to add to that, Dave?
No, just extension of that would be the advent of AI underwriting tools that help circumvent the lack of claims data that some of the fully insured employers get. It's making it a little bit easier for stop loss carriers to get comfortable taking those risks absent the claims data.
Okay. Yeah, that's a great point with all the new AI tools that are coming out and where those play a role. Awesome. Great question. Ready for our next one?
Hi, this is Emily. I'm calling from Indianapolis, and my question is, What internal stakeholders need to be involved before moving forward with the captive arrangement?
So I'll take a crack at that one.
Okay.
When an employer is looking at joining a captive, they are becoming a part owner in a captive reinsurance company. And so, my advice to anybody that's evaluating one of these programs is just to make sure that, everyone from the HR team that's actually working with the employees to the financial side of house, the CFO, executive leadership, and certainly, internal counsel, you really want to make sure the whole team has visibility to the program, understanding is comfortable, and that puts you in a really good position to move forward and be successful.
Yeah, that makes sense. And obviously, you're working with your broker partner, and it's a collaboration as well. But any other kind of stakeholders that you'd bring to the table there in terms of even outside the organization?
Well, one thing that's really important to understand when you join a captive is your benefits consultant is still, leading the charge for your individual insurance program. And so they're going to be heavily involved throughout the entire process, going to be an advocate for you within the captive, a resource for you as you're getting exposed to additional ideas and strategies through the program.
I think one other important factor when you think outside of the individual company is, to the outside world, a company, a member still has a stop loss policy. No different than how it functions, whether you're in a captive or not. So to those third-party administrators and pharmacy benefit managers, the functionality of the captive really doesn't play a role in what they do. The captive is a reinsurance mechanism behind the scenes. So one of the misconceptions is, well, now claims are going to get paid differently or reimbursed differently. That actually doesn't happen. The transparency allows you to follow the bouncing ball relative to where the claims get paid or reimbursed, but the TPA function doesn't change. Mm-hmm. Okay. So there have been times where people have wanted to actually make it more complicated than it actually is, thinking they need to go move a bunch of pieces around when in actuality that's really not the case.
Gotcha. And I think that's helpful to understand that that a lot of those things don't change at all. All right, next question.
Hi, this is Danny from Atlanta, and my question is, what role does a broker or consultant really play once an employer joins a captive?
We get this question a lot, right? Some brokers are worried it's going to be a ton of work and they're not really sure what their role is going to be. What do you want us to take the first tab?
Yeah,
Dave?
So I think the role of the consultant becomes even more important when an employer joins a captive because there's more that they can actually do for that employer versus fully insured. So there's a mindset shift, not only for the employer, but also the relationship that they have with their broker or consultant, where they almost move from broker to consultant when they join a captive, because now it's not, how are we going to shop your insurance at renewal? How are we going to manage your claims, the other 9, 10, 11 months out of the year? Mm-hmm. And the renewal process is it's just more of the process. It's not an event, if that makes sense.
Mm-hmm. It's not a one-time thing where we're just connecting this time of year. It's, okay, how do we build it for the whole year?
I was just going to add that, we get a lot of positive feedback from our benefits consultants. So we have health risk management workshops that the captive members participate in, but the brokers are also invited to and participate regularly in. And, I've had benefits consultants that we work with say that they learn more at those workshops than any other, single event that they do throughout the year. So wow. We've had a lot of really good feedback about how they then can bring those strategies that they're learning about to other customers as well.
Yeah.
And the captive doesn't cut the broker out. I think that's important. It, as Dave said, should strengthen. We want them strengthen the relationship. We want them part of those meetings. We want them engaged on the webinars. But captive resources, or really any captive consultant, shouldn't and doesn't replace the broker dynamic. We want to partner with them versus replace them.
Yeah, and maybe to piggyback a little bit more, Dave, what you said, it's not only expanding the relationship, is not necessarily more work necessarily, is it? Because I think that's another kind of misconception. Is it more work? Is it the same? Is it a different type of work?
I think it shifts the work. So instead of having to slog through a frustrating renewal process for 3 months, It's more, spreading that work out throughout the course of the year and focusing on problematic areas with claims, and then figuring out what point solutions or cost containment strategy can we deploy to sort of plug that hole. And then again, the renewal is a non-event because we know what we're going to be looking at come time for the renewal. It's not a surprise.
Mm-hmm. Awesome. Yeah, that's an important one. So thank you for the question. Next one.
Hi, this is Charlie from Philadelphia. And my question is, how do captives handle high-cost claimants from year to year?
This is important. I think it's kind of part of the scare factor, right? Like, ooh, what if we get this big claim and, how are we protected? What does that look like? So I think the question, the heart of it is more like, how is it handled when it comes up?
I'll take a stab at it. High-cost claimants are going to happen. You purchase stop-loss insurance for that reason. So a single employer is not on the hook year in and year out for unlimited risk. The captives are designed to not be on the hook for all of that. The captives take a defined risk layer. So one claim in most circumstances really can't hurt the captive based on the size and scale that they have. And that's strategic in how they're set up. When it comes to renewal, though, one of the benefits of the program and being an owner of the captive is the ability to really make financial decisions to benefit your company and your bottom line. So yes, our captive programs are no new laser rate caps built into the stop loss. But from a consulting perspective, we're having discussions with brokers and members well ahead of renewal about ongoing large claimants. And do they want to see a laser option or an option where they're going to pay a little more premium for it? So the optionality and the flexibility around how high cost claimants are treated come renewal time is very important. And then the protection that one or a few high cost claimants won't hurt the captive in totality because of how they're set up gives groups kind of that peace of mind going into it, knowing that they're not on the hook for something extremely catastrophic.
Gotcha.
And I'll just add that I think being a part of the captive, getting exposed to strategies that different companies are using, certainly, leveraging underwriting and clinical resources from the carrier standpoint. Hopefully we're, at our best, we're circling the wagons when those situations come up and trying to work with the benefits consultant, with the member to bring strategies that are going to help them address those. Because there is a lot out there that you can do these days.
Yeah, there are. It's almost overwhelming. That's why it does help to know, like, hey, we tried this, it worked, or it didn't, and this is why. And there's different, risk tolerances too to some of these solutions and what one employer is willing to do and not another. But that sharing is key.
The one last thing I would add to that is in these programs, the underwriters are much more interested about future outlook on claims than trying to recoup. So some of the largest claims are one and done events. So it's much more about, okay, that's done, that's in the past. We want to know what's going to happen in the future year. And that's really how they're trying to price the stop loss.
Gotcha. Which makes sense if you're trying to gauge, what's going to happen in the future.
But I think the traditional market would react differently in those situations. They're typically looking to get their pound of flesh, even if the future outlook on those claims are non-existent.
Gotcha. More so punishing you for the past instead of looking to the future.
Right.
Gotcha.
Yep.
All right. Awesome. Next question, please.
Hi, it's Amanda calling in from New York City. I was wondering, do I set up a separate bank account when starting a captive?
Set up a separate bank account.
So for those groups that are looking to transition from fully insured to self-funded, this is a pretty common question that we hear. And yes, so because you are now the plan sponsor and you are funding those aggregate claims, you're going to set up a separate checking account that the TPA will auto draft from, typically on a weekly basis. So they'll send you a claims report on like a Wednesday so that you can review it. If you have questions, you can get back to them. And then they typically are auto drafting on like a Friday. So, there's dollars moving. There is some ebbs and flows when you're paying those claims, especially in the first year as you get used to, all right, I'm just stroking one check for premium every month. going to now you're funding claims as they're incurred.
Relative to the captive, though, they don't need to set up a separate bank account. There are investments that go into the captive that will sit on their balance sheets as assets. They're not sunk costs, so if they ever leave, they get those back.
Okay.
They'll earn investment income on those that they see relative to the financial statements, but they don't need a whole separate bank account apart from what Dave talked about just to join the captive.
Okay.
And being a member-owned captive, excuse me, they have oversight into the investment strategies that they're using as a captive insurance company.
And the financial statements are audited.
Awesome. Yeah, that's something we don't talk about a ton, but the captive investors fund, they're pooling the money, and that is being used to the advantage of the whole captive, right?
Yeah, exactly. So the Captive Investors Fund is a $10 billion mutual fund that is set up with the primary goal of preservation of capital for the members, of course, but also set up in a way to be able to get them, have their money work for them and get them a nice return on the dollars while they're sitting in the account.
Okay, awesome. Next question.
Hey, this is Tyler from San Diego, and I was wondering, what if we have a terrible experience in the captive? Then can we go back to a fully insured market? Thank you.
Every member at renewal time has the ability to make their own renewal decision. So yes, can groups leave the captive and go back fully insured or back to the self-funded market? Of course. We have seen a 98+% retention year in and year out within all of the captive programs. So it doesn't happen a lot. But everybody needs to make decisions for their own company, financial and otherwise. So there are no golden handcuffs. You don't forfeit anything if you decide to leave the captive based on performance and the investments we talked about. So the short answer is yes, you can always make that decision to leave if you so choose.
One thing I would add is it's actually quite easy to leave a captive arrangement if you feel like it's not in your best interest anymore. Traditional stop loss will provide run-in coverage on the stop loss policy. You might have some of these investments that they've talked about tied up for a period of time, but eventually you get them back. Mm-hmm. But that's a question we get often is it really hard to leave a captive? And the answer is no. But yet we still have the really strong retention rate that we're proud of.
Well, and even the time frame, compared to if folks out there have been in casualty programs, there's a little bit of a longer tail due to the nature of that line of business. On the health side, it's pretty short tail, so those dollars are coming back in pretty short order, and we're able to close out those years, and so it wouldn't be a really long wait to get all your dollars back if you're leaving.
Awesome. So the short answer is yes. Do most people? No.
Yeah, love it. Well wrapped up.
You should have answered.
There we go.
Yeah.
No. Well, those are all the questions that we received. Thank you so much for sending those in, everybody. We hope to do this again. We appreciate your feedback. Before we wrap it up, I'd love to hear what kind of questions do you all get from brokers or in the field that you think are just important to repeat here today? Do you have one, Joe?
Yeah, one question I've heard a lot over my time here is, how much of a time commitment is this if I join the captive, meaning a group? And it's pretty simple. It doesn't add a bunch of time to what they have to do from their everyday company perspective. The captive has one board meeting, which is typically 2 to 3 days. The captive has one health management workshop, which we've talked a little bit about, which is typically 2 days. A lot of times you won't see the same people attending both of them. Health management workshops tend to be more HR driven, whereas board meetings, you see more presidents, CFOs, CEOs. And then every month there are webinars on timely topics. Those are recorded, so you don't have to join exactly at the time it's being done live. And you can have multiple people join. So it doesn't add a ton to any one person's plate. Now, there are always opportunities to get more involved if an individual so chooses. But just from being in the captive doesn't mean you are managing healthcare really any differently.
Mm-hmm. Yeah. Yeah, great question. I think that's something that people are kind of worried about, or it scares them, but it's and it's as little or as much as you want it to be too. You could really roll up your sleeves, or not as much. So makes sense. Do you have one, Kevin?
A common question that I hear, and a lot of companies out there that are in casualty group captives. So from those folks, I often hear, we've put a lot of strategies in from a safety standpoint, from a PPE standpoint, from a hiring standpoint, that we feel we can really impact the number of claims that we're having and stop people from getting hurt on the casualty side. But we're not totally clear how we can stop people from getting sick on the health side. And so, they're kind of wrestling with that as they're thinking about a health captive. And so my answer to those folks would be, there are some things you can do to hopefully catch some, good screening practices to help catch diseases earlier where they're less costly and better outcome for the employee. But also, a lot of what is talked about at the board meetings and workshops amongst the members is trying to find ways to impact costs once people do get sick. And there's a lot of different strategies you can use to try to lower the ultimate cost of healthcare.
Gotcha. Super helpful. Awesome. Dave, you want to wrap us up here?
Yeah, so we have 40-some business development executives spread throughout the country working with brokers and consultants. And as you can imagine, there's some consultants that have been doing this for a decade and really understand the ecosystem. And there's some that are now just realizing like this is the way the market is moving. And so for this end of the spectrum, those brokers and consultants are really leaning on us for expertise of that ecosystem. And that's a big reason why we've got our strategic partnership solutions team, is to help bring those solutions to the market when they make sense, right? Not everything is always going to make sense. They are optional. But it really does help those brokers and consultants look like the experts when they bring our BDEs in and they bring those solutions to the table.
Awesome. Yeah, thanks for that plug, because it's a newer department for us, and being able to recommend those different strategic partners. And it's open architecture, of course, like we've talked about, but for brokers and groups looking for those recommendations and negotiated pricing terms and conditions, we have those too. So thanks for adding that at the end. All right. Well, thank you guys for attending our Ask Us Anything session. This was super insightful and helpful. Hopefully we answered all of your questions and more, and just appreciate you being with us today.
Thank you, Madison.
Thank you.